Frailty is a problem we all need to address. As a physician, you are seeing more and more of your aging patients become frail and the effect that that frailty has on the quality of their lives. The health outcomes, sadly, can be and are poor. This isn't news, but let's face it, we need to address it because it's costly, it uses up valuable resources, it undermines efficiency in our hospitals, and it's only going to get worse unless we get ahead of this curve. That's why we're introducing CARES, an innovative upstream approach to frailty prevention designed to delay frailty in at-risk seniors with chronic diseases. CARES is an evidence-based, comprehensive geriatric assessment. That assessment generates a sensitive and reliable measure of a patient's frailty status. With it, you're able to accurately place patients on the Rockwood Clinical Frailty Scale with confidence.
How do we deal with people who have many things wrong if the standard way that we've done things, which is to treat these things one at a time, if that not only doesn't work, it actually makes people worse off? So there's a couple things. One is a frailty index, and the other one is a geriatric assessment.
Geriatric assessment is not a new concept. It has been around for some time now, and the benefit has been well documented.
There's a test that you do standing up from a chair. There is a measurement of your memory.
But we also do some other things which often don't get done quite as much.
It is especially important when an older person becomes ill, for instance, because sometimes the functionality can change. And therefore, what we need to do is, through the comprehensive nature of this assessment, have a very good way to looking and measuring in terms of where people potentially may need a little bit more help.
In order to address care in people who are frail and address the aging population, we need to really rethink what care is for these people.
So what we tried to do with the frailty index is to provide a number, because that will help them anticipate the things that are likely to require attention.
Acute care is really good when you have one medical problem, when you have the acute crisis. It's not really good for dealing with people with chronic comorbidities or multiple medical problems, such as people who are frail.
This tool actually gives you a frailty index score between 0 to 0.7, and 0.7 being near end of life, but 0 to 0.1 being quite well.
We take the number of things someone has wrong, we have to divide that by the number of things that we counted. So the comprehensive geriatric assessment form, the one that we use, has about 70 items embedded in it.
I think in order to make it as easily doable as possible, we need to make sure that the document is in the EMR, the physician's computer that they're using on a regular basis, that is integrated with everything else, so that the ECGA document actually self-populates with all the information that's already in the EMR. So it's a very powerful way of assessing whether the person's lifestyle is making a difference to their frailty progression and therefore their aging. Once the assessment is done by the GP and their frailty assessment is completed, these patients are encouraged to enroll in the BC Self-Management Program.
With so many people having chronic health conditions, you only access a health professional for a short period of time. So that's when we thought of the idea of having a peer supporter.
These are coaches that have been trained to help people to monitor and manage their chronic conditions.
In the Fraser Health region, we have close to 1,000 people who've been trained to either lead a self-management program that we've trained or participate in self-management programs.
A peer coach is someone who, by telephone, connects with a participant on a weekly basis.
Once a week for 30 minutes, the coach would telephone the participant.
The goal of a peer coach and this process is to get the participant to learn how to self-manage their own conditions.
You keep giving me encouragement, which I really need, because sometimes it's very hard to give yourself encouragement.
There's a lot of resources available in the community that patients don't necessarily take up, but if they're asked by their family physician and a coach is calling them on a regular basis to enact that wellness plan, it helps with their motivation.
And we know as well that there is a connection between brain function and body function. In general, when we talk about exercise program, for instance, what's good for the body is also good for the brain.
Well, I'm feeling a little bit stronger, but I know all the muscles that I have that don't work anymore, are not working well, take time to get stronger.
The overall message is that frailty is measurable, we can do something about it, and there's going to be increasing evidence as to what we can do.
After watching this video, which outlines the details and support that it includes, I encourage you to join us in making CARES a program that will provide your patients with a better quality of life.
It is possible to age well and avoid frailty.